Posttraumatic Stress Disorder, PTSD. Definition of PTSD. Post-traumatic stress disorder, PTSD, is a mental health condition triggered by experiencing or witnessing a traumatic event. It is characterized by a range of symptoms that can significantly impact a person's daily life, including intrusive memories, avoidance behaviors, negative changes in mood and thinking, and heightened physical and emotional reactions. PTSD can develop after an individual has been exposed to events such as military combat, natural disasters, serious accidents, terrorist attacks, or personal assaults like rape. While it's normal to experience distress and anxiety following such events, PTSD occurs when these symptoms persist and intensify over time, disrupting normal functioning. Brief history of PTSD recognition and diagnosis. The recognition of PTSD as a distinct mental health condition has evolved significantly over time. During World War I, soldiers exhibiting symptoms of what we now know as PTSD were often diagnosed with shell shock or combat fatigue. These terms reflected the belief that the condition was caused by physical brain damage from the explosions and concussions of war. It wasn't until the 1980s that PTSD was officially recognized as a diagnosable disorder in the Diagnostic and Statistical Manual of Mental Disorders, DSM-3, by the American Psychiatric Association. This inclusion marked a significant shift in understanding the psychological impact of trauma and the need for specific treatment and support for those affected. Importance of understanding PTSD. Understanding PTSD is crucial for several reasons. First, it enables early identification and intervention, which can prevent the disorder from becoming chronic and debilitating. Second, it fosters empathy and support for individuals living with PTSD, reducing stigma and encouraging them to seek help. Lastly, it informs the development of effective treatments and interventions, ultimately improving the quality of life for those affected. As we explore PTSD in detail, it is essential to keep in mind the human aspect behind the condition. Each person with PTSD has a unique story, and understanding these stories can provide valuable insights into the complexities of the disorder. Causes of PTSD. PTSD can develop after exposure to a traumatic event. The nature and impact of the trauma can vary widely, and not everyone exposed to the same event will develop PTSD. Factors such as personal history, genetic predisposition, and the availability of social support can influence the likelihood of developing PTSD. Traumatic events. 1. Military combat. Veterans are among the most studied groups for PTSD. The intense stress and life-threatening experiences of combat can lead to significant psychological trauma. 2. Sexual assault. Survivors of rape and other forms of sexual assault often experience PTSD. The violation of personal safety and bodily autonomy can have profound and lasting effects. 3. Natural disasters. Earthquakes, hurricanes, floods, and other natural disasters can lead to PTSD. The sudden and uncontrollable nature of these events contributes to the psychological impact. For serious accidents, car crashes, industrial accidents, and other severe incidents can result in PTSD. The shock and potential for injury or death create a highly traumatic experience. 5. Terrorist attacks. Events like bombings, shootings, and other acts of terrorism can lead to widespread trauma and PTSD among survivors and witnesses. Risk factors. 1. Genetics. There is evidence to suggest that genetics can play a role in the development of PTSD. Individuals with a family history of mental health disorders may be more susceptible. 2. Environment. Childhood trauma, such as abuse or neglect, can increase the risk of developing PTSD later in life. An unstable or unsafe environment can also be a contributing factor. 3. Personality. Certain personality traits, such as a tendency toward negative thinking or a lack of coping skills, can make an individual more vulnerable to PTSD. For social support, the presence or absence of a strong support system can significantly affect the likelihood of developing PTSD. Those with supportive friends and family are generally more resilient. Understanding the causes and risk factors of PTSD is essential for prevention and treatment. By identifying those at higher risk, we can provide targeted interventions to reduce the incidence and severity of PTSD. Symptoms of PTSD. The symptoms of PTSD are categorized into four main types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. These symptoms can vary in intensity and duration and may not appear immediately after the traumatic event. Intrusive memories. 1. Flashbacks, vivid, distressing memories of the traumatic event that can make the individual feel as though they are reliving the experience. 2. Nightmares, disturbing dreams related to the trauma that can disrupt sleep and contribute to ongoing distress. 3. Distressing memories, unwanted and recurrent thoughts about the traumatic event that can interfere with daily life. Avoidance. 1. Avoiding reminders, deliberately avoiding places, people, activities, or situations that remind the individual of the traumatic event. 2. Emotional numbing, efforts to suppress emotions and feelings associated with the trauma, leading to a sense of detachment from others. Negative changes in thinking and mood. 1. Negative thoughts, persistent and distorted beliefs about oneself or others, such as feelings of guilt, shame, or being permanently damaged. 2. Emotional blunting, difficulty experiencing positive emotions, leading to a sense of numbness or detachment. 3. Memory problems, difficulty remembering important aspects of the traumatic event. Changes in physical and emotional reactions. 1. Hyperarousal, being easily startled, feeling on edge, or having difficulty concentrating or sleeping. 2. Irritability and anger, increased irritability, anger, and aggressive behavior. 3. Self-destructive behavior, engaging in risky or self-destructive behaviors, such as substance abuse. Recognizing these symptoms is critical for diagnosing and treating PTSD. Early intervention can help mitigate the severity of symptoms and improve outcomes for those affected. Diagnosis of PTSD. Diagnosing PTSD involves a comprehensive evaluation by a mental health professional. This process includes assessing the individual's symptoms, understanding their history, and using standardized diagnostic criteria. Diagnostic Criteria, DSM-5. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, outlines specific criteria for diagnosing PTSD. These criteria include: 1. Exposure to trauma. The individual must have experienced, witnessed, or been confronted with an event involving actual or threatened death, serious injury, or sexual violence. 2. Intrusive symptoms. The presence of one or more intrusive symptoms, such as flashbacks, nightmares, or distressing memories. 3. Avoidance. Persistent efforts to avoid reminders of the trauma. 4. Negative changes in cognition and mood. 2 or more symptoms of negative changes in thinking and mood, such as memory problems or negative beliefs. 5. Arousal and reactivity. 2 or more symptoms of increased arousal and reactivity, such as hypervigilance or irritability. 6. Duration. Symptoms must persist for more than 1 month. 7. Distress or impairment. The symptoms must cause significant distress or impairment in social, occupational, or other areas of functioning. Assessment tools. Mental health professionals use various tools to assess PTSD, including: 1. Clinical interviews, structured or semi-structured interviews to gather detailed information about the individual's symptoms and history. 2. Questionnaires, standardized questionnaires, such as the PTSD checklist, PCL, to measure the severity of symptoms. 3. Self-report scales, such as the Impact of Event Scale, IES, to assess the subjective impact of the traumatic event. Challenges in diagnosis. Diagnosing PTSD can be challenging due to several factors. 1. Symptom overlap. Symptoms of PTSD can overlap with other mental health conditions, such as depression and anxiety disorders. 2. Delayed onset. Symptoms may not appear immediately after the traumatic event, leading to delays in diagnosis. 3. Stigma. Individuals may be reluctant to seek help or disclose their symptoms due to stigma or fear of judgment. Accurate diagnosis is essential for effective treatment. Mental health professionals must consider the full context of the individual's experience and use a combination of tools and criteria to make an informed diagnosis. Prevalence and demographics. Understanding the prevalence and demographics of PTSD helps to identify at-risk populations and inform targeted interventions. Statistics on PTSD in various populations. 1. General population. The prevalence of PTSD in the general population varies, but studies suggest that approximately 7 to 8% of people will experience PTSD at some point in their lives. 2. Military veterans. PTSD is particularly prevalent among military veterans. Estimates suggest that between 10 to 30% of veterans will experience PTSD, with higher rates in those who have seen combat. 3. First responders, police officers, firefighters, and emergency medical personnel are at increased risk of PTSD due to their exposure to traumatic events in the line of duty. 4. Survivors of assault, individuals who have experienced sexual assault, physical assault, or other forms of personal violence have a higher prevalence of PTSD. 5. Natural disaster survivors. Those who have lived through natural disasters also show elevated rates of PTSD. Differences in prevalence by gender, age, and occupation. 1. Gender. Women are more likely to develop PTSD than men. This disparity is often attributed to differences in the types of trauma experienced, with women more likely to be victims of sexual assault and men more likely to experience combat-related trauma. 2. Age. PTSD can occur at any age, but certain age groups may be more vulnerable. For example, children and adolescents who experience trauma are at higher risk of developing PTSD. 3. Occupation. Certain occupations, such as military personnel, first responders, and healthcare workers, have higher rates of PTSD due to the nature of their work. Understanding these demographic factors helps to identify those most at risk and tailor prevention and intervention efforts accordingly. Effects of PTSD on daily life. PTSD can have a profound impact on various aspects of an individual's life, affecting their relationships, work, and physical health. Impact on relationships. 1. Family. PTSD can strain family relationships. Symptoms such as irritability, emotional numbing, and avoidance can create distance and conflict between the individual and their loved ones. 2. Social life. Individuals with PTSD may withdraw from social activities and relationships, leading to isolation and loneliness. 3. Parenting. PTSD can affect parenting, with symptoms potentially impacting the ability to provide emotional support and stability to children. Occupational consequences. 1. Job performance. Symptoms such as concentration problems, memory issues, and emotional reactivity can affect job performance and productivity. 2. Absenteeism. Individuals with PTSD may have higher rates of absenteeism due to their symptoms or related medical appointments. 3. Career advancement. PTSD can hinder career advancement due to the challenges in maintaining consistent performance and building professional relationships. Effects on physical health. 1. Chronic pain. Individuals with PTSD often report higher levels of chronic pain, which may be related to the stress and tension associated with the disorder. 2. Cardiovascular health. PTSD is linked to an increased risk of cardiovascular problems, including hypertension and heart disease. 3. Sleep disorders. Sleep disturbances, such as insomnia and nightmares, are common in individuals with PTSD and can contribute to overall health decline. Recognizing the wide-ranging effects of PTSD is crucial for providing comprehensive care and support to those affected. Addressing these impacts can help improve the overall well-being and quality of life for individuals with PTSD. Comorbid conditions. PTSD often occurs alongside other mental health conditions, complicating diagnosis and treatment. Recognizing and addressing these comorbid conditions is essential for effective management. Depression. 1. Overlap with PTSD. Many individuals with PTSD also experience depression. Symptoms such as persistent sadness, loss of interest in activities, and feelings of hopelessness are common. 2. Impact on treatment. The presence of depression can complicate PTSD treatment. Integrated approaches that address both conditions are often necessary. Anxiety disorders. 1. Generalized anxiety disorder, GAD. Individuals with PTSD may also experience GAD, characterized by excessive worry and anxiety about various aspects of life. 2. Panic disorder. Panic attacks and panic disorder are common in individuals with PTSD, leading to intense episodes of fear and physical symptoms such as heart palpitations and shortness of breath. 3. Social anxiety disorder. PTSD can contribute to social anxiety disorder, with individuals avoiding social situations due to fear of judgment or distressing memories. Substance abuse. 1. Self-medication. Individuals with PTSD may turn to alcohol or drugs as a way to cope with their symptoms, leading to substance abuse disorders. 2. Impact on recovery. Substance abuse can hinder the effectiveness of PTSD treatment and complicate the recovery process. Integrated treatment approaches that address both PTSD and substance abuse are essential. Recognizing and treating comorbid conditions is crucial for comprehensive care. Mental health professionals must consider the full range of symptoms and conditions to provide effective treatment. Treatment options. Effective treatment for PTSD involves a combination of psychotherapy, medication, and emerging treatments. The choice of treatment depends on the individual's symptoms, preferences, and overall health. Psychotherapy. 1. Cognitive behavioral therapy, CBT is one of the most effective treatments for PTSD. It helps individuals identify and change negative thought patterns and behaviors. Cognitive processing therapy, CPT, a form of CBT that focuses on changing the negative beliefs related to the trauma. Prolonged exposure therapy, PE, involves gradual exposure to trauma-related memories and situations to reduce fear and avoidance. 2. Eye movement desensitization and reprocessing, EMDR involves guided eye movements while recalling the traumatic event, helping to process and integrate the trauma. 3. Dialectical behavior therapy, DBT combines cognitive behavioral techniques with mindfulness practices to help individuals manage emotions and reduce self-destructive behaviors. Pharmacotherapy. 1. Selective serotonin reuptake inhibitors, SSRIs, such as sertraline and paroxetine, are commonly prescribed to manage PTSD symptoms, particularly depression and anxiety. 2. Serotonin norepinephrine reuptake inhibitors, SNRIs, such as venlafaxine, can also be effective in treating PTSD. 3. Prazosin. This medication is used to reduce nightmares and improve sleep in individuals with PTSD. For other medications, depending on the individual's symptoms, other medications, such as antipsychotics or mood stabilizers, may be prescribed. Emerging treatments. 1. Psychedelic therapy. Research into the use of psychedelics, such as MDMA and psilocybin, shows promise in treating PTSD. These therapies are still in experimental stages but have shown significant potential. 2. Neurofeedback. Neurofeedback involves using real-time monitoring of brain activity to teach individuals how to regulate their brain function and reduce PTSD symptoms. 3. Virtual reality exposure therapy, VRET uses virtual reality to simulate trauma-related situations, providing a controlled environment for exposure therapy. Effective treatment often involves a combination of these approaches, tailored to the individual's needs. Continued research and innovation in PTSD treatment hold promise for improving outcomes for those affected. Coping strategies for PTSD. In addition to professional treatment, individuals with PTSD can benefit from various coping strategies to manage their symptoms and improve their quality of life. Self-help techniques. 1. Mindfulness and meditation. Practicing mindfulness and meditation can help individuals stay grounded and reduce anxiety. 2. Exercise. Regular physical activity can improve mood, reduce stress, and enhance overall well-being. 3. Healthy lifestyle. Maintaining a healthy diet, getting adequate sleep, and avoiding alcohol and drugs can support recovery. Support groups. 1. Peer support. Joining support groups with others who have experienced similar traumas can provide a sense of community and understanding. 2. Online communities. Online forums and social media groups can offer support and resources for individuals with PTSD. Lifestyle changes. 1. Stress management. Learning and practicing stress management techniques, such as deep breathing, yoga, and progressive muscle relaxation, can help manage PTSD symptoms. 2. Routine. Establishing a daily routine can provide structure and stability, helping individuals feel more in control. Implementing these coping strategies can complement professional treatment and enhance recovery. Encouraging individuals with PTSD to explore and adopt these techniques can help them manage their symptoms more effectively. PTSD in specific populations. PTSD can affect various populations differently, and understanding these differences is essential for providing targeted support and interventions. Military veterans. 1. Combat-related trauma. Military veterans often experience PTSD due to exposure to combat and other life-threatening situations. 2. Transition to civilian life. The transition from military to civilian life can be challenging, with PTSD symptoms complicating this process. 3. Veteran-specific support. Various organizations and programs provide specialized support for veterans with PTSD, such as the Veterans Affairs (VA) healthcare system. First responders. 1. Exposure to trauma. Police officers, firefighters, and emergency medical personnel are regularly exposed to traumatic events, increasing their risk of PTSD. 2. Occupational stress. The high-stress nature of their work can exacerbate PTSD symptoms and contribute to burnout. 3. Support programs. Many first responder organizations offer peer support programs, counseling, and other resources to help manage PTSD. Survivors of assault. 1. Personal violence. Survivors of sexual assault, physical assault, and domestic violence often experience PTSD. 2. Trust and safety issues. These individuals may struggle with trust and feelings of safety, impacting their relationships and daily life. 3. Specialized therapy. Trauma-focused therapies, such as EMDR and CPT, can be particularly effective for survivors of assault. Children and adolescents. 1. Developmental impact. Trauma can have a significant impact on the development of children and adolescents, affecting their emotional and psychological growth. 2. Behavioral symptoms. PTSD in young people may manifest as behavioral problems, such as aggression, withdrawal, or academic difficulties. 3. Family involvement. Involving family members in therapy can provide additional support and create a nurturing environment for recovery. Understanding the unique challenges faced by these populations allows for the development of tailored interventions that address their specific needs and circumstances. Research and future directions. Ongoing research into PTSD continues to expand our understanding of the disorder and inform new treatments and interventions. Current research on PTSD. 1. Biological factors. Research into the biological underpinnings of PTSD, such as genetics and neurobiology, is helping to identify potential targets for new treatments. 2. Psychological factors. Studies on cognitive and emotional processes in PTSD are shedding light on how trauma affects the brain and behavior. 3. Treatment efficacy. Ongoing clinical trials are evaluating the effectiveness of various therapies and medications, including emerging treatments like psychedelic therapy and neurofeedback. Future prospects in treatment and understanding. 1. Personalized medicine. Advances in genetics and neurobiology may lead to personalized treatment approaches based on an individual's unique biological profile. 2. Technology and therapy. Innovations in technology, such as virtual reality and mobile health applications, are providing new ways to deliver and enhance PTSD treatment. 3. Preventive interventions. Research into early interventions and preventive measures aims to reduce the incidence of PTSD in at-risk populations. Innovations in therapy and support. 1. Teletherapy. The expansion of teletherapy provides greater access to treatment for individuals who may face barriers to in-person therapy. 2. Community-based programs. Community-based support programs are being developed to provide accessible and comprehensive care for individuals with PTSD. 3. Integrated care models. Integrated care models that combine mental health, medical, and social services are being explored to provide holistic support for individuals with PTSD. The future of PTSD research and treatment holds promise for more effective and personalized interventions, ultimately improving outcomes for those affected by this disorder. Personal stories and case studies. Personal stories and case studies provide valuable insights into the lived experiences of individuals with PTSD, highlighting the diversity of the condition and the impact of effective treatment. Real-life accounts of individuals with PTSD. 1. Military veteran. A story of a combat veteran who developed PTSD after serving in a war zone and found recovery through a combination of therapy, medication, and peer support. 2. Assault survivor, the journey of a sexual assault survivor who navigated the challenges of PTSD and found healing through trauma-focused therapy and community support. 3. First responder, an account of a firefighter who developed PTSD after responding to a series of traumatic incidents and found relief through EMDR and resilience training. Analysis of case studies. 1. Trauma history, understanding the individual's trauma history and how it contributed to the development of PTSD. 2. Symptoms and diagnosis, a detailed look at the symptoms experienced and the process of diagnosis. 3. Treatment and recovery, the treatment approaches used and the factors that contributed to successful recovery. Lessons learned. 1. Resilience and recovery, the importance of resilience and the factors that support recovery, such as social support and effective therapy. 2. Individualized treatment, the need for personalized treatment plans that address the unique needs and circumstances of each individual. 3. Ongoing support, the role of ongoing support and maintenance strategies in managing PTSD and preventing relapse. These personal stories and case studies underscore the importance of understanding the human aspect of PTSD and the potential for recovery with the right support and treatment. PTSD and society. PTSD has significant implications for society, including the need to address stigma, improve representation, and advocate for greater awareness and support. Stigma and misconceptions. 1. Public perception, misunderstandings about PTSD can lead to stigma and discrimination, hindering individuals from seeking help. 2. Combating stigma, efforts to raise awareness and educate the public about PTSD can help reduce stigma and promote understanding. 3. Personal advocacy, encouraging individuals with PTSD to share their stories can help challenge misconceptions and foster empathy. Media representation. 1. Portrayal in media, the portrayal of PTSD in movies, television, and other media can influence public perception, for better or worse. 2. Accurate representation, advocating for accurate and sensitive representation of PTSD in media can help raise awareness and reduce stigma. 3. Impact on public awareness, positive media representation can contribute to greater public awareness and support for individuals with PTSD. Advocacy and awareness. 1. Advocacy organizations, various organizations advocate for the rights and needs of individuals with PTSD, working to improve access to treatment and support. 2. Public awareness campaigns, campaigns aimed at raising awareness about PTSD can help educate the public and reduce stigma. 3. Policy and legislation, advocacy efforts also focus on influencing policy and legislation to ensure that individuals with PTSD receive the support and resources they need. Addressing the societal impact of PTSD is essential for creating a supportive environment that promotes understanding, reduces stigma, and provides comprehensive care for those affected. Resources and support. Numerous resources and support options are available for individuals with PTSD and their families. Organizations providing help. 1. Veterans Affairs, VA. The VA offers a range of services for veterans with PTSD, including therapy, medication, and support programs. 2. National Center for PTSD, a resource center providing information, research, and support for individuals with PTSD and their families. 3. Nonprofit organizations, various nonprofits, such as the PTSD Foundation of America and the Anxiety and Depression Association of America, offer resources and support for individuals with PTSD. Hotlines and emergency contacts. 1. Crisis Text Line, a free, 24/7 support service that individuals can access by texting. 2. National Suicide Prevention Lifeline, a hotline providing confidential support for individuals in distress. 3. Veterans Crisis Line, a hotline specifically for veterans experiencing a crisis. Books, websites, and other resources. 1. E-books, there are many books available on PTSD, ranging from personal accounts to self-help guides and professional resources. 2. Websites, websites such as the National Center for PTSD and the PTSD Alliance provide valuable information and resources. 3. Online courses and webinars offer education and training on PTSD for individuals, families, and professionals. Access to these resources can provide valuable support and information for individuals with PTSD and their families, helping them navigate the challenges of the disorder. Conclusion. Summary of key points. 1. Understanding PTSD. PTSD is a complex mental health condition that can develop after exposure to trauma. Recognizing the symptoms and seeking early intervention is crucial for effective treatment. 2. Impact of PTSD. PTSD can affect various aspects of life, including relationships, work, and physical health. Comorbid conditions such as depression and substance abuse are common and must be addressed in treatment. 3. Treatment and coping. A combination of psychotherapy, medication, and coping strategies can effectively manage PTSD. Emerging treatments and ongoing research hold promise for improving outcomes. Importance of continued research and support. 1. Innovative treatments. Continued research into new treatments and interventions is essential for advancing our understanding of PTSD and improving care. 2. Public awareness. Raising public awareness and reducing stigma can encourage individuals with PTSD to seek help and support. 3. Advocacy and policy. Advocacy efforts are crucial for ensuring that individuals with PTSD receive the resources and support they need. Final thoughts on the journey towards understanding and managing PTSD. PTSD is a challenging condition, but with the right support and treatment, individuals can lead fulfilling and meaningful lives. Understanding the complexities of PTSD, advocating for greater awareness, and continuing to innovate in treatment are essential steps in supporting those affected by this disorder. The journey towards understanding and managing PTSD is ongoing, and with collective effort, we can make a positive impact on the lives of those affected. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.